Have you ever witnessed a seizure and felt unsure of what to do? What if the seizure doesn't stop? Would you know how to react? Seizures can be frightening, but knowing the right steps can make a life-saving difference. In this video, we'll explain what status epilepticus is, how to respond to seizures safely, and the do's and don'ts every caregiver, family member, and person with epilepsy must know. Before we begin, don't forget to subscribe to our channel, hit the notification bell so you never miss an important update, and share this video to help spread awareness. You know, as a doctor, I've seen firsthand how scary seizures can be. And one of the most critical things to understand is status epilepticus. It's a situation where a seizure lasts for an extended period, more than 5 minutes, or when someone has multiple seizures in a row without regaining consciousness. Now here's why it's so crucial to understand this. Status epilepticus is a serious medical emergency. We're talking about the potential for long-term consequences, even life-threatening situations if it's not treated quickly and effectively. There are two main types of status epilepticus: convulsive and non-convulsive. Convulsive status epilepticus, or CSE, is what most people picture when they think of a seizure. The full-body convulsions, the loss of consciousness, the shaking. It's impossible to miss. But then we have non-convulsive status epilepticus, NCSE. This one is trickier. It might not be as dramatic, but it's just as dangerous. We're talking about confusion, staring spells, unusual behavior, things that can easily be missed or misinterpreted. The bottom line is, whether it's CSE or NCSE, recognizing status epilepticus and taking immediate action is absolutely critical. Every second counts. Alright, let's talk about what to do if you see someone having a seizure. First things first, stay calm. I know it's easier said than done, but your calm demeanor can make a world of difference. While staying calm, start timing the seizure. This is crucial information for medical professionals later on. Now, if the seizure lasts longer than 5 minutes, that's our cue. We need to call 911 immediately. While we're waiting for help to arrive, our focus shifts to keeping the person safe. Clear the area around them, move any furniture or objects they might hit. If possible, place something soft, like a pillow or a folded jacket, under their head to prevent injury. Next, gently roll them onto their side. This helps keep their airway open and allows any saliva or vomit to drain, preventing choking. Another important step is to loosen any tight clothing around their neck. Again, this is all about ensuring they can breathe easily. Throughout this entire process, stay with them, talk to them calmly and reassuringly, even if they're unresponsive. Let them know that you're there, that help is on the way, and that they're going to be okay. Your presence can be incredibly comforting. Now, just as important as knowing what to do during a seizure is knowing what not to do. There are a lot of misconceptions out there, and some well-intentioned but misguided actions can actually cause more harm than good. First and foremost, do not, under any circumstances, put anything in their mouth. I know you might have heard about people swallowing their tongues, but trust me, it's a myth. Putting something in their mouth can obstruct their airway, making it even harder for them to breathe. And speaking of making things worse, do not try to restrain them. Seizures are powerful, and trying to hold them down can lead to injuries. Your goal is to keep them safe, not to restrict their movements. Next, resist the urge to offer them food, water, or medication while they're still actively seizing. They're not in a state to swallow safely, and this could lead to choking. And lastly, remember what I said earlier. Stay calm and reassure the person that all is well. Your emotional state and composure can have a ripple effect on those around you, including the person experiencing the seizure. Panicking will only escalate the situation. So, the seizure has stopped. Now what? Well, the first thing to remember is that it takes time to fully recover from a seizure. They might be confused, disoriented, exhausted, even a little emotional, and that's completely normal. Your job now is to be patient and supportive. Stay with them until they're fully alert and oriented. Let them know where they are, what happened, and reassure them that they're safe. They've just been through a lot, both physically and emotionally. Next, take a moment to check for any injuries that might have occurred during the seizure. Did they bump their head? Are there any cuts or bruises? If you notice anything that needs attention, provide basic first aid, and, if necessary, don't hesitate to seek medical attention. While you're at it, try to jot down what you observed during the seizure, how long it lasted, what type of movements they were making, anything that seemed to trigger it. This information can be incredibly helpful for their doctor in adjusting their treatment plan. Speaking of treatment, if they're on seizure medication, make sure they take it as prescribed. Consistency is key when it comes to managing epilepsy. You know, as much as we focus on what to do during a seizure, it's equally important to talk about long-term care and, even better, seizure prevention. For people living with epilepsy, managing their condition is a marathon, not a sprint. Medications are often the first line of defense when it comes to controlling seizures. And taking those medications exactly as prescribed, never missing a dose, is absolutely crucial. Think of it like this. Medication helps maintain a stable environment in the brain, preventing those electrical storms that lead to seizures. But medication alone isn't always enough. Lifestyle plays a huge role as well. Sleep, for example, is critical. Fatigue is a well-known seizure trigger, so establishing a regular sleep schedule and ensuring they're getting enough rest can make a world of difference. And then, there's stress. We all know how detrimental stress can be to our overall health, and for people with epilepsy, it can increase the likelihood of seizures. Finding healthy ways to manage stress, whether it's exercise, meditation, spending time in nature, is essential. And just like we want to avoid things that trigger seizures, we also want to avoid things that make them more likely. Alcohol and drugs, for example, can lower the seizure threshold, making seizures more likely to occur. It's best to avoid them altogether. Now, every person with epilepsy is different. What triggers a seizure in one person might not have any effect on another. That's why it's so important to identify their personal triggers. Keeping a seizure diary, noting down when seizures occur, what they were doing beforehand, how they were feeling, can reveal patterns and help them avoid those triggers in the future. And lastly, consider a medical alert bracelet. It's a simple but effective way to communicate their condition to others, especially in emergency situations. We have all types of videos on our channel, from real-life seizure videos and education on many different types of seizures to emotional support, relaxation techniques, music for sleep, nature sounds, and community support live sessions. Whether you're looking for more information on managing epilepsy, need a moment of relaxation, or want to connect with others who understand what you're going through, our channel is here to help. Dive into our playlists to find the resources you need, and remember, you're not alone in this journey. We're all in this together, supporting each other every step of the way. Seizures can be scary, but knowing the right steps can save a life. Whether you have epilepsy or know someone who does, being prepared makes all the difference. Subscribe to our channel for more life-saving information, hit the notification bell so you never miss an update, and share this video to raise awareness and help others learn what to do. Together we can support and protect those living with epilepsy. Thank you for watching. Stay safe and take care.